Well, I obviously was trained as a doctor, and I always wanted to be one and loved it. I loved taking care of patients, and it was really a center of my life. But I also had an interest really back into high school in policy and government and kind of social sciences. And I always wanted to combine them. So when I was in medical school, I had the opportunity to get a joint degree in public policy at the same time. They had instituted a new program at Harvard, an MD, MPP program, and I was in the second class ever in that combined program. So the public policy program was as eye-opening to me as medical training was. In medicine, I was learning how to take care of patients and illness. In the public policy program, I was learning how to think systematically about decisions, about policy, about management decisions, about assessing technologies and evaluation, a lot of quantitative methods. So I really wanted them I just wanted to find a way to put them together. When I was in training, then in residency, I kept noticing things that weren't going well, waiting times and just things that didn't seem to be managed. And the Kennedy School training let me have some tools, decision theory, quantitative analysis, operations research, economics, political science, psychology, that just helped me see what was going on. And the question was, how could I get a combination of the ability to see patients and also affecting the world of patient care? And that door got opened to me by Dr. Howard Hyatt. He was the dean of the Harvard School of Public Health. And he we knew each other, and he was setting up a center at the School of Public Health it was called the Center for Evaluative Clinical Sciences. And or a Center for Evaluation of Clinical Practices. And he invited me to join that center as a young doctor, and partly seeing patients, partly doing research, and that was like the beginning for me. So there I worked with mathematicians and statisticians and economists and psychologists and sociologists in this joint center, and it was it was amazing. I started to be able to see how I could apply methods of what I now know to be system sciences in healthcare, and so it actually traces back to that combination of desires to be somehow in the world of policy and management, and somehow in the world of the clinical work at the same time.